Thank you so much for the opportunity to present this experience that we have. And yes, indeed, we have one of the first, probably the first massive open online course in digital health, in mobile health, and that was called Mobile Health Without Borders. Stanford University, where I work, being so innovative in education, they decided to have a new format, a new platform, so we can deliver education to students throughout the world. And the vice provost of education had some grants, some seed grants available to all of us, so we could start having some of these MOOCs. And we applied for this. It was a very small grant, and we were pretty much the only MOOC that was granted from the medical school. We know it's, I don't think I need to teach all of you how the business model of medicine is a very poor business model, where we actually cannot really scale for the most part, and what we do is just on single basis, a physician and a patient, physician and a patient, so it's not very scalable. It is very restricted for those resources, and by leveraging on mobile health, on digital health, we can certainly bring that to the masses. So what we did is we created this platform with that seed grant that we obtained, and we applied for this 2 years ago. The first iteration of this MOOC was done last year, and what we did, just pretty much like Doctors 2.0 or like Stanford Medicine X or like another major conference, we have a group of very, very prestigious innovators in the world of, in the arena of health and also in the arena of digital health to be involved in our course. And we then created a platform. There are a number of platforms that you have available in the market. We chose a one called NovoEd that has changed over the last 2 years with the learning that we have had with this, where students, I keep wanting to say patients, but students throughout the world were able to join the course for free and be able to take this class. The course itself, it has changed from a 7-week course to one that has pretty much 5 weeks where you can actually join for free, and then you can, you're going to have assignments every week or so you can see very small lectures, very brief lectures that they can go from anywhere from 2 minutes up to some like maybe 25 minutes each lecture. Denise was one of our first batch of experts on digital health, so we could get the landscape from throughout the world, and especially from Europe. But once you have that platform, you can go on your own time, whenever your own convenience, and you can actually go through the assignments that you can get. And this is the way that you can actually see how things go. You can see the students pretty much from everywhere throughout the world. There are some places that were very difficult to tap, and one of those is China, from some of the restrictions that we have with internet access to our website. But what we can see is that it's a very diverse group, which makes it very interesting. Now, I wish I can... There you go. So the first time that we did this, we had over 8,000 students who were registered. And we had a completion rate about 33% of the students, which is very, very high for a MOOC. Now, lots of you, perhaps people who would be classic academicians, may say that 33% is very poor when it comes to a class for a completion rate. But you will see that the expectations that we should have for an online course like this one should be very different and should be realistic and should be also adapted to the needs that the students would have for this. Now, we revised our course in such a way that we decided, well, we should have less weeks. Instead of having like 7 weeks, we had actually like 4, but they were just spread into more time. So it was actually 6 weeks, but only 4 classes. And we recreated our course. We implemented some more of these lectures. And we had the second one having over 5,000 students, or same sort of rate of adoption. Now, the most important thing out of this MOOC, it's not the fact that we have created PhDs or have created masters in digital health, is just the network that we have. And actually, for some of us, the teachers of this MOOC, we have learned more from our students than probably some of the students have learned from us. This is a very diverse group, just like with anything else with mobile health or with online media. You can see that the ages, 25 to 35, probably are the highest users of this sort of platforms. We certainly have the engaged students who had involvement over more than an hour per week. We're certainly over 33%, which were the ones that finished the course. And we can see also the diversity. Lots of these people, they're highly accomplished people. This is not just someone who goes online and wants to just see what this is all about. This is people who are actually very prepared. People with masters, people with PhDs, and certainly some others with other type of postgraduate education. What we learned from this is that the most important thing, as I said, was to create networks of people from all areas throughout the world and to empower them to have a connection that otherwise it would be impossible for them to have. We should feel very fortunate that we made it to this conference, but there's also people that, you know, they don't have the means how they can just travel or they can get access to this information. And we have been able to actually connect them with some of us so they can truly create new networks of people, of talent, so this can result in new companies for that. I think there were some that were lost, but I guess we will just talk about them later. With this, I have to say that, you know, it was a fantastic, fantastic opportunity for us. We, for the last 2 years, have grown up so much in the sense that what started like just a simple class, we have had registered students over like 15,000 now. And once the students have become part of our class, they can go to the same platform and continue with the collaborations with other students that they have learned from now on without having restricted to the time that they were allowed to stay in the class. Examples of success that we have had is from this, new companies are being developed, new organizations are being developed. Just recently, the National Association of Telemedicine for Mexico was created by one of the groups that met in this class. And so just like that, the new iterations that we're going to have with this class will will bring investors, they will bring entrepreneurs, and they will be able to identify some of those groups that have actually created very good platforms to deliver digital healthcare. With this, I would like to thank you again, and this is a great experience for me. Thank you, Denise.